Welcome back, everyone. Well, it's Monday, and guess who's back? Dr. Paul Arciero. So we're going to talk about health-related issues. Interestingly enough, both of us, within the span of a week, had back problems. So I said to Paul, why don't we let's do one of these on back pain.
Yeah.
And we come to find out that back pain is a medical condition that costs our medical system about $50 million a year. Now, that'll show you how pervasive it is.
Very common.
Very common. So, look, let's get into back pain and what causes it. And let me do the joke first, okay? Okay,
Yes.
We did that good.
Okay.
Glad we got that out of the way. What are the causes of back pain?
Oh, there's so many causes. But let's just start with one: poor body posture. So people just aren't in good alignment, right? They sit slouched over, watching TV or at their computer. Another would be trauma. People have been traumatized somehow with that injury. And then imbalances is another very common case. And then we have also degeneration. The discs and the bones undergo degeneration.
Oh, as a result of age.
As a result of age, yeah,
Right,
and some
right.
health conditions as well. But a lot of it is just that poor body alignment and poor posture.
Right. Trauma is an easy one to figure out. You whack it, you do something wrong, and you know immediately because you either hit the floor or everyone around you hears it.
Yeah.
Because the pain just immediately grabs
It
you.
seizes you up. And the reason it seizes you up, of course, is because of the spasming of the muscles that are trying
Right.
to do that in an attempt to
To
protect.
protect it, right,
Yeah.
right. That I've heard before. Stress and tension. You know, I've heard this frequently from people. I'm under a lot of stress, and I'm getting headaches, my back hurts, and stuff like that. Does that happen?
Absolutely. It's
Oh,
called
it does?
Yeah, it's the mind-body connection.
Okay.
And so when your mind is not in a good place, that stress is picked up in different places in our body. And one of the most common places, Jesse, we know people when they get stressed, they often get headaches, right? We get other people that get stomach ailments and digestive issues, ulcers. Well, there's a large segment of the population that when they become stressed, it's felt in their back. And so there's a large segment and a growing amount of in the healthcare profession anyway, of belief that this stress is picked up in the back and causes some of that tension.
I've got you.
Leading
Okay.
to back.
So, age is pretty easy to understand. But say you go through trauma,
Yeah.
you go through some kind of imbalance, you go through stress or tension. Let's jump to the treatment side.
Yeah. Okay, so the treatment is going to involve one of the places where you have the back ailment. So I just want to jump back just for a second.
okay,
So this
sure.
will help the treatment make a little bit more sense. When you look at the back and the anatomy of the back, it's made up of bones, the vertebrae,
Oh, that's right. You were saying that. That's right.
the muscles,
Right.
the tendons, the
Right.
ligaments, the nerves that's
Right.
associated with the pain that we feel, and then the discs that provide the cushion in between the vertebrae.
Right.
So when you take a look at what causes a back injury or pain, you have to address all 6 of those places, or all
Right.
6 of those components of a person's back. And then the treatment is determined based upon where that injury, insult in the back has occurred.
Right, when you realize that the spine is composed of the discs,
Complex.
and all of these things are complex,
Ah.
and running down the center of the spine, of course, is your central nervous system.
Spinal column,
Right.
Yeah, your spinal cord. Yeah.
So
So it's
they're,
a very tender place.
Yeah.
And so as you can imagine, all of our cells of our body, all of our vital organs, everything emanates from that spinal column.
Yes, right, true.
So when you have an injury to it, you feel it. And in many cases, it's debilitating. It seizes you right where you are. So in terms of treatment, the first line of defense with a back injury is to try to get your spine back into alignment.
Right.
And so for most people, that means bed rest, getting the person lying down so that that spine can relax. And then ice. So resting it by lying down, icing it. And then you can also contrast that with some heat occasionally, but ice is the primary one. And then, of course, painkillers, muscle relaxants. And then there are also a group of individuals that provide manipulation to put the back into alignment.
Oh,
A
like
chiropractor.
yes, physical
A
therapist.
physical therapist,
Right.
absolutely. A massage therapist.
Right.
So all of them play a role in helping the back return back to a state of health.
I want to cycle back on a couple of things
Sure.
here in the treatment so that we just don't go through a laundry list here. You mentioned rest. Very difficult to convince yourself to stay down, but you made a point before we went on air that struck me. It's to take the gravitational stress
Yes.
off of your back. So really getting off of your feet is an important aspect of
It is. Yeah, the gravitational compression force. So when you're sitting up, particularly you have that compression, and then when you go to stand up, you can have some of that compression. So by lying down, it alleviates that gravitational compression force on the disc. Because of what you want to do, you want to stay hydrated so that those discs can then rehydrate and hopefully get back into alignment as well.
Now, you talked about some of these modalities like heat and ice. How do you know whether to use heat or whether to use ice?
That's a great question. Ice, I think you can't ever go wrong with. So I don't think there's a healthcare provider that would not recommend ice for some injury. So ice is mandatory, but the heat comes into play, especially if you're going to be needing to move. Let's say you had to go to an appointment, you have to go to ice. The heat has a tendency to increase the blood flow to that working muscle. So heat is really important for the muscles and the tendons and the ligaments. The ice is important to help quell and reduce the swelling, but the addition of the heat just helps it feel a little bit looser so that you can get up and move if you have to.
And then some of the drugs, and there's some homeopathic solutions as well. But let's just hit some of the obvious ones. Muscle relaxer.
Muscle relaxers, right, because of the spasm that we talked about and that protective.
The muscles go right to work as the arm guard. So, you know, you trespass on there, those muscles react right away, right?
Yeah, no, they do, and there's significant amount of involvement. So you have muscles, you know, coming from all different places in your body to compensate for that injury in your back. And so if you go to a good practitioner, massage therapist, physical therapist, chiropractic, they'll often work in unrelated areas to your spine. Because they have to release that tension in those other muscles to begin to work on the real problem area of the back. And then, so muscle relaxers are helpful in that way if you're so inclined to take the drugs, and then the pain relievers, because it is painful. So that combination are
Can we throw a little Jack Daniels in there, you think, or?
On occasion, if it's needed.
No, but that was a very good answer. Thank you. Some of the homeopathic solutions. You were mentioning ginger before.
Ginger's
things I would never think of. Cinnamon.
Ginger, cinnamon. Well, because they're anti-inflammatory.
Oh, okay.
So the ginger, the cinnamon, the tart cherry juice. So these are things that are laced with what we call nutraceuticals or phytochemicals.
Okay.
Many people also house the name of antioxidants in those categories. So those are foods rich in antioxidants. And why that's important is because when you have a back injury, you have trauma and you have inflammation. And you want to reduce that inflammation and increase blood flow. And so those homeopathic remedies, those nutraceuticals of ginger, cinnamon, tart cherry juice.
Right?
What's that?
Turmeric.
Turmeric?
Yes.
Excellent. Thank you for reminding me about that one.
Good.
Turmeric is also a very useful one as well.
Great, Paul. I mean, you know, I could talk to you forever about this stuff. One thing we discovered, by the way, that when we were thinking about how prevalent back pain was, we realized that headaches are another one. So next week it's headaches, right?
Yep.
Well, we're covering everything.
We're getting the whole, man.
We're getting the whole thing done.
What a show.
I love it. Well, thank you very
fun.
much for coming in. Remember, back pain, most important to rest. Seek some help, physical therapy, massage therapy, chiropractic, some medicines and whatever, and give it time.
We didn't talk about surgery, but that is a last resort, which I'm glad
we'll leave that one out.
We'll leave that one out.
Paul, thanks for coming in.
You're welcome.
Okay. To see this interview again, please head to our website, looktvonline.com.